back then we didn't know. She always made it seem like we had everything else everybody else had. She was a single mom at some points working 3 jobs. I remember she was a teacher's aide during the day. She would get off and be work at the YMCA, the child care, and on the weekends she worked at Asteroid. And I look back at it now and I'm like, wow, how did we make it? So we learned about AccessHealth when we first moved to Fort Bend. We had Medicaid. I mean, you're kind of limited when you have Medicaid. My mom brought us here so that we can get quality health care with the insurance that we had.
The attitude about Fort Bend County around the country is that it's an affluent county, that you've got everything you need. These planned communities are great, but there are pockets of poverty. You can't just do what had been done for decades, turn your back to it, act like it's not there. It's there. Those children who come from those households sit next to the other kids in school. You know, you can't say that it doesn't affect you. If you don't have a healthy community or healthy kids, you know, you're not going to thrive. AccessHealth is the group that provides that gap in coverage. Without them, the quality of life in this county wouldn't be what it is today. It wouldn't be as good as it is today.
So for us, we see the community and we kind of figure out where we could play a role in making things better. And medically, obviously there's a need for kiddos that are going back to school. So annually, the first 2 Saturdays in August every year, we host a back to school health fair for all members in our community to be school ready with medical, social, unlimited services and prepare them for the school year to come. But beyond that, you're gonna get a haircut if you need one. You're certainly gonna get a school bag full of materials that'll get you ready for school. And then you'll go out and you'll see organizations that'll talk to you and educate you about things that are gonna help you be better prepared. And sort of this holistic approach to back to school beyond health goes a long way. People will get here at 6 in the morning and start lining up. It's a really, really impressive thing to see.
I didn't realize there'd be a line wrapped around the building for these services. It really was kind of startling. And it's turned out, for me, to be a very, very joyous occasion. But when you see the kids and the parents, they're with them, it's a festive atmosphere. They're getting screened for this, that, and the other. There are all kinds of services and things that we're being made aware of. It's just a great activity.
So all my nieces come here, my nephew, my sister's kids, and my brother's kids come here. I want someone to love my kids and give my kids the best like I would. And so, and AccessHealth does that. You know, they make me feel like my kids are important to them like they are to me.
Everybody knows that the patients are why we're here. And when you put the patient first and foremost, I think everything else really falls in line. So for us, it's ultimately to provide health care to anybody in the county that needs it. And we want to be the medical home for all of the folks in the county that would qualify for AccessHealth as their provider, as the safety net.